at the Pittsburgh Medical School?
I used to teach in the medical school, third-year medical students, teach them how to read medical journal articles so that they can apply in their practice. That's what I did, and then after that I did a lot of drug development work in which we developed drugs for hypertension, congestive heart failure, many other conditions.
Hypertension, blood pressure, right?
Right.
Okay. What kind of drugs were developed by you that can help somebody get this problem down? Because that's an epidemic problem.
Yes, hypertension. Yeah, there are many class of drugs for hypertension, and newer drugs are being developed as we speak. Because this is a problem, because what happens is certain drugs have side effects, so we are always looking for new drugs where we have lesser side effects and are more effective. So that's what we're doing, and of course this is a lifestyle disease, so again one of the things is to reduce stress. Stress is a factor in every single disease, whether it is hypertension, diabetes, or any other kind of disease. So therefore that is very important to reduce the stress. Secondly, exercise. Exercise is absolutely, we are learning again more and more in some form of exercise. You cannot do a heavy exercise, just walk for 15 minutes, at least 3 times a week. That should do it. Yeah, if you can't do any heavier than that, if you can join the gym, of course, that would be very helpful. And again, one of the important things now we are learning more and more, most of these diseases are relating to weight. Obesity, as we know, in our country is very high. It's about more than 2/3. Either we are obese or morbidly obese, where what we call the body mass index, if it hits above 440, then it is morbidly obese. And of course, anything above 29 we consider as obese. So that's all these diseases, diabetes, hypertension, what we call metabolic syndrome, they're all related to weight. So I would say recommend that that is the first thing. And we actually have at the event here a tool that we can assess and provide you some of the parameters which will give you the body mass index, your body age. Your body age tells you in terms of your chronological body age versus actual body age. So the goal is to have your body age to be either equal to or less than your chronological age. So that we can do, and also there is something called visceral fat, which is a fat inside your organ, and that is very predictive of heart conditions. So we can assess that. So it's a good opportunity for people to come out here and we can do the assessment for you.
Now, how is the assessment done?
This assessment is a very simple tool. It is a non-invasive tool where you just stand with your bare foot. What it does is essentially it sends a very low electric current, and through which we assess, and this is a validated tool against more involved procedures. For example, so what it does is we will take your height, your age, gender, and we put that information and you stand on it, and after a minute or so you will get all those parameters that we just talked about. And that will give you at least the baseline, and from there we will recommend to do it every 3 months so that we can monitor and suggest based on those parameters what you need to do depending on your goals.
Now, is this assessment a free thing here at the Marion County Fair?
We have, from the administrative cost, we have kept $10 because of the processing of the papers and all that. So it's a $10, yeah, minimal. You can get the assessment done.
Are there any types of medication or things that are specific to you that you do differently than other doctors?
Well, I have known, because I did a lot of drug development work, so I understand the side effects of many of the drugs. We just don't have any drug which does not have side effects. It's just a matter of having a better profile. But what I recommend is some alternative form of therapy, especially in terms of supplements, which can help. For example, fish oil we actually developed into a drug, but also which is not a drug. again, it's a matter of the purification of the fish oil. So you can, it would have a similar effect, but it is not approved by the Food and Drug Administration. But they are organic, and in fact, the company that I'm very comfortable with, they have their organic farms in California, Washington, and from seed to packaging, they do it on the farm. So I'm very comfortable recommending those products. I take myself, so I actually don't recommend anything that I have not taken. I mean, of course, except relating to products which are for females. But they are good, and you can try. In fact, one of the good things is if you don't like it, and you can return in 6 months, money back guaranteed. So that's another good thing. So,
why do some doctors not use medicines that are not approved by the Food and Drug Administration? Because if I go to my regular practitioner, I assume that most of the drugs they're prescribing me are regular Food and Drug Administration items.
Well, there are drugs, if you claim that this is going to treat, diagnose, or prevent a disease, then FDA would require you to get it approved. As long as you are not making those claims, it does not fall into the category of a drug. And so therefore, you can recommend that, for example, dietary supplements, other therapies, which FDA does not regulate. Of course, there are many reasons for that. And also they are considered as food. They are basically supplementing your food. For example, we need vitamin A, vitamin B, vitamin C. We would like to get all that from our food, but we know that we usually don't get it. So therefore, it becomes necessary to supplement. Not only that, the farming practices have changed over the years. So the nutrients we used to have in what your fruits and vegetables, we don't have that amount of nutrients now. So that's another factor. You should supplement them. And for example, a good example is according to the recommendation of World Health Organization, we are supposed to get 5 to 7 servings. In the US, actually, that number is even higher, 9 to 11 servings of fruits and vegetables. And if you were to take that every day, then you will be sitting all morning, evening, cutting the fruits and vegetables. So therefore, it becomes a necessity to supplement those.
I hear about blueberries and cinnamon and strawberries. This is the healthiest food you can eat. What is the if I am going to get something in my diet every day that's just going to be good, what is it?
Well, definitely, I agree with what you say. Berries, definitely, whether it's blueberry, strawberry, all kinds of berries, they're good. They're good for your overall health, for your mental health. So definitely, I would recommend that. And of course, the different colors which are important. So you should have white, yellow, orange, purple, different colors of fruits and vegetables. If you can take those, that would be definitely a great help to.
Is there any way, because I know a lot of people go through this who are in their 70s and 80s now, who when they were young, there was no Surgeon General warning on smoking, and they have done some damage to their lungs. Is there any way, any food, natural idea that can reverse some of that damage without, not on oxygen, but just, a COPD or something like that?
Well, one of the things is obviously for the older population, one of the challenges to go out and, outside, obviously, if you can do that, definitely do that. And certain things which are, for example, a lot of the beverages, they're acidic, so they're not very helpful to your lungs. Already, if the lungs are damaged, you want to reduce that consumption of those. And now we also have something, if you have an issue with the oxygen, we have oxygenated water. There are actually, you can get oxygenated water that may help. So, plus, it has other properties, it's kind of what they call microstructure. So you can take that if you have that issue with COPD, and especially those who have breathing difficulties. So those things, you certainly can. Then of course fruits and vegetables, and if there may be at times, check your iron level also, because sometimes If it is low, then it does not have the oxygen carrying capacity. If your hemoglobin is low, then check that. If that's the case, your doctors can prescribe some iron supplements.
Just a couple more questions. We started talking about hypertension and blood pressure. Is there a food, medicine's always good, but is there a food that I can eat that over time, or maybe even immediately, will help with my blood pressure?
Well, one thing you want to avoid is, again, a lot of processed food. You want to eat in terms of, as close to the raw food. In terms of, again, hypertension as such, I would just recommend general fruits and vegetables should be helpful.
This is the 165th Marion County Fair. If I want to be here for the 265th, what should I do?
Well, what should you do exactly? You should certainly exercise, no question about it. You need to exercise at least 3 times a week. Of course, if you can do 5 times, that's definitely. Drink plenty of water. For every 15 pounds of your weight, you should have 8 ounces of water. So drink plenty of water. It does help in terms of maintaining your weight as well, plus of course overall health. And one thing I would recommend highly is actually our immune system is in our gut. 3/4 of our immune system is in our gut, so I would recommend taking probiotic. We have learned a lot in the last 20 years about probiotic. It's very good. Because in your gut you have bad bacteria. What you really want to do is to increase good bacteria. So probiotic will provide that. So I would recommend, some probiotic which has at least few, 5-6 strains on it. So take that.
What is a probiotic?
Probiotic is in our gut, in our colon, you have bad bacteria. So what we want to do also, like in your yogurt, you would have heard the term acidophilus. Those are good bacteria. But in probiotic, we have different type of strains of bacteria, and they are called good bacteria. If you increase their level, it helps overall your digestive health, plus your overall health, and also it will increase your immunity. So it will help you in terms of infections that you may get. Allergies, and in some cases, of course, we don't have that much data, asthma in the kids, so that's what it will do for you.
I have a final question for you. I was recently visiting somebody in the hospital, and I asked one of the nurses and doctors there this. Of all the medical technology and all the things we've been able to do over the years, heart transplants now, and bypass surgeries, and all those things, why, and I understand the theory behind why vomiting gets the bad stuff out quickly. But why have we never been able to, I don't want to say cure, but stop it? If people have a problem with this, acid reflux that causes them to vomit, or things of that nature, what can I do not to have that happen often, like with the flu?
Well, of course, you want to reduce acidic food. Number one, you want to have more alkalinity in your system, so you take, as I said, the oxygenated water. And the other thing was, sometimes what happens is your esophagus gets narrower as we age, so sometimes they dilate. So if that is the issue, you have what is called the GERD, gastroesophageal reflux disease. Then you may want to talk with your gastroenterologist. They actually can widen that. Sometimes there's not simple solution to that. If you're having vomiting or nauseating feeling and the things are coming up, that could be a problem. And plus, of course, you, as I said, drink plenty of water, reduce the acidic foods. Some of them are very, especially the soda.
Lemon juice and olive oil, the Greeks swear by. Is that really going to keep me around forever too? Keep me moving?
Well, of course, olive oil is absolutely a good thing. I mean, if you are cooking using olive oil, continue to do that, definitely. And lemon, of course, long time back when Dr. Linus Pauling, who got Nobel Prize twice, is one of the exceptions. He advocated the use of vitamin C for cancer. At that time, people thought it's just really out of the ordinary, bit of crazy, but it turned out that he was right. And in fact, a lot of National Institute of Health has funded many projects. So yes, continue to take lemon and olive oil. They are good for you.
Perfect. And you are in Dublin, Ohio?
I'm in Dublin, Ohio.
And you'll be here at the Marion County Fair today?
Yes, I will be here till 6 o'clock. That's the goal. So if anybody has any questions, stop by and we can do your health assessment. If any other questions, feel free to ask.
Right here in the Marion County Veterans Memorial Coliseum, Dr. Anand Seth. Thank you so much.
All right.
It's been a pleasure. Thank you so much. Take care. And we're here again, 165th edition of the Marion County Fair. And we're having a good time. What an interesting interview that was. Very fascinating. A lot of information that I hope the listening audience enjoyed from Dr. Seth. Harry, did you pick up anything on that?
Learned quite a bit from that interview. It's a good interview. I'm going to practice some of those.
Are you going to pay the $10 and go and stand on the
No, I don't know.
It's worrisome, isn't it?
Yeah.
We worry that we might be older than what we think we are.
Exactly.
The man with the golden voice, presidential candidate Ted.
North End. You know where Polaris is?
I'm in Dublin, actually. I'm in Dublin.
Well, I lived in Dublin. I lived over by Dublin Jerome High School.
Oh, really?
Yeah, right down on Highland Troy. Yeah. Let me see this real quick. Listen.
You only have one book.
Oh, I got one book left. I'm only selling it for $20.
Is this
you
your-
like the
is
Help
your
the
family?
Ted Williams Project? Here, just read this. I want you to read that.
Go and talk to them.
Can you read that?
Granddaughter?
No, they are my daughter. Go and talk to them.
Your daughters? Yeah, my daughters was talking to them about doing
Hello.
the hand.
Hello.
Yeah.
Hello.